I'm Dr. Farrow. I'm a family medicine doctor with Beacon Medical Group, Porte in Indiana. Yes, in fact, most of the poison ivy cases we see are in the spring and the fall because that's when most of us do a lot of our clearing, gardening, clearing of brush, and preparing for change of season. So that's when most people have their exposure to poison ivy, poison oak, or poison sumac. A mild rash may just be pink to red rash. In fact, what people will notice first is that they actually get itchy in that area, right? A more severe rash or a bigger reaction may be a patchy rash that might even be raised like hives. The first thing you should do if you suspect you've had contact with the oil from the poison ivy plant is go and wash it off. Okay. Once the oil is off, it's done, although your body may still react. Your immune system's working well. But the biggest thing to do is stop contact with the oil. Then you have to worry about and work on things to calm down the reaction. If it's mild, there are things over the counter like antihistamines, such as Benadryl that you can use. Some doctors like to have patients use topicals. I prefer the Benadryl. I suggest you get in contact with your primary care provider for any instance of poison ivy type rash, allergic type rash. We're talking specifically of poison ivy because everybody or many people know about it, but this can happen with other plants, just with a smaller group of people. So I suggest you contact your primary care provider anyway, no matter what. However, some people who have experience with it, who know they're having a mild reaction, just a small area, they know what to do because they've dealt with this before. Severe reactions, think of the rash being very spread out on your body. We call that diffuse, being hives-like, and possibly, which is thankfully rare, but involving your respiratory system such that it makes you have some swelling in the respiratory tract. So someone with asthma might be at greater risk of this than someone who doesn't have asthma. No, poison ivy is not contagious. It may look like it's contagious because you can start the reaction where you actually had skin contact, but if the reaction is sufficient enough in your body, if you do nothing to calm down the reaction, the histamine release in one area will then cascade and cause histamine release and the symptoms in other areas. So the rash will spread and it looks like you have an infection, but you don't. It's just the reaction spreading. So poison ivy is not contagious and you can't catch it from somebody or give it to somebody else. It depends on how severe the rash is. Often with the minor episodes or cases of poison ivy, a few days. I do not recommend this, but occasionally someone's rash will get better because they were like, I've had this 50 times and I don't want to do anything and I know it's mild. I still think they should talk to their doctor and take some antihistamine. But it can be from a few days to longer, but the longer the longer time frame to resolve tends to be more severe cases. As with this and other medical matters, I highly recommend that you contact and work with your Beacon primary care provider, family medicine provider. We are here to help you. We like to help our patients maintain and improve their health. And this is just one more thing that is part of often normal human experience that we can help you with. To find a primary care provider near you, please visit beaconhealthsystem.org online.